According to the World Health Organization, novel coronavirus or COVID-19 is affecting 235 countries around the world. Hello everyone, my name is TJB Romero, a first-year criminology student at University of Mindanao Bansaran College. My topic is all about the novel coronavirus or COVID-19. Coronavirus disease is a newly infectious disease caused by a newly discovered coronavirus. And sad to say, antibiotics do not work against these kinds of viruses. Some people who become ill with COVID-19 can also develop a bacterial infection as a complication. In this case, antibiotics may be recommended by the healthcare provider. It is believed to have zoonotic origins and has close genetic similarity to bat coronaviruses, suggesting it emerged from a bat-borne virus. But there is no evidence yet to link an immediate animal reservoir. First human cases of COVID-19 were reported by officials in Wuhan City, China, last December 2019. Retrospective investigation by Chinese authorities have identified human cases with onset of symptoms in early December 2019. While some of the earliest known cases had a link to a wholesale food market in Wuhan, many of the initial patients were either stall owners, market employees, or regular visitors to the said market. An environmental sample taken from the market last December 2019 tested positive for SARS-CoV-2, further suggesting that the market in Wuhan City was the source of this outbreak and played a role in the initial amplification of the outbreak. The market was closed last January 1, 2020. On January 30, 2020, the Philippine Department of Health reported the first case of COVID-19 in the country, with a 38-year-old female Chinese national. On March 7, the first local transmission of COVID-19 was confirmed, and as of October 23, 2020, the Philippines has 363,888 cases of COVID-19 with 312 recoveries, and sad to say, there are 6,783 deaths. Davao Region's first case was confirmed by the Department of Health Davao Region Office on March 15, 2020. The case was a 21-year-old female resident of Pantukan, Davao de Oro, who had a travel history to United Kingdom and Manila. The patient arrived in Davao City on February 29 and was placed in isolation at a health facility last March 9, 2020. After undergoing consultation for a cough, the following day the patient was referred to Davao Regional Medical Center in Tagum and tested positive. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, and speak. These liquid particles are different sizes ranging from smaller respiratory droplets to smaller aerosols. Other people can catch COVID-19 when the virus gets into their mouth, nose, and eyes, which is more likely to happen when you are in direct or close contact with the infected person. Current evidence suggests that the main way the virus spreads is by respiratory droplets among people who are in close contact with each other. Now, the question is how to prevent the spread of the virus. According to the World Health Organization, to prevent the spread of the virus, we must obey the minimum public health standard. First, clean your hands often. Use soap and water or a 70% alcohol-based and rub. Second, maintain 1 meter safe distance from anyone. Third, wear a mask. Fourth, don't touch your eyes, nose, or mouth. Fifth, cover your nose and mouth with your bent elbow or a tissue when you are cough or sneeze. Lastly, if you have a fever, cough, and difficulty in breathing, seek medical attention. These times we must follow what the government wants us to do to stop the spread of the virus. Because in these hard times, we need unity. The government itself can stop the virus. I will end this speech with a quote, "We are in together and we will get through this together." Thank you and God bless us all.